Hello, everyone, and welcome to this year's CR Arthritis event. I'm Kelly Lendvoy, VP of Communications and Public Affairs at ACE. It's my pleasure today to speak to not one, not two, but three of the presenters at the annual meeting this year. And welcoming to them to the show today are Natasha Trehan, Dr. Stephanie Garner, and Dr. Michelle Batthish. Welcome to the show.
Thank you for having us.
Instead of me doing these long bios, I'm going to ask you just to go around the room here and introduce yourselves to our audience, please.
All right, I'm Dr. Steph Garner. I'm an adult rheumatologist at the University of Calgary with an interest in pediatric transition care, and it's great to be here today. And then we also have Dr. Michelle Batthish.
Thank you, Steph. I'm Michelle Batthish. I'm a pediatric rheumatologist at McMaster University, working at a McMaster Children's Hospital. Also have an interest and passion for youth with chronic rheumatic disease as they transition from pediatric to adult care.
And my name is Natasha. I am that young adult with a rheumatic disease, and I live with juvenile idiopathic arthritis. I was diagnosed at the age of 13, and I'm also a university student studying translational and molecular medicine at the University of Ottawa.
Thank you. And I must say that usually these are one-on-one, and I really do enjoy this opportunity that ACE has to meet all the smart people that are attending the meeting. To be surrounded by three of them is a little intimidating, but I'm going to do my best. And we're going to focus on a workshop that all three of you are co-presenting. The title of the workshop is The Emerging Adult with Rheumatic Disease, What Adult Rheumatologists Need to Know. And I think just at the start, emerging adult is a term some of our audience might not be familiar with, but what is the focus of this workshop? And when we talk about the emerging adult and the challenges in care, what exactly are we talking about?
I can get started with that. So, of course, I see a lot of pediatric patients with rheumatic disease in my practice, but as they grow older and move into adolescence and eventually adulthood, their disease stays with them. And so they have unique needs that will require ongoing care into the adult healthcare system. Of course, this is a time when their brains are still developing, and their social circles, school life, family lives are changing and rapidly evolving. So many things are happening all at the same time as this transition period when they have to move from pediatric to adult care. And nothing magical happens when they turn 18. And so that's why we use the term emerging adult, because development, brain development, social development, and so forth continues to happen beyond their 18th birthday, well into their 20s. And so that's the period of time that we are referring to, this kind of emerging adulthood.
And when we look at that transition that you're describing, Dr. Batthish, and I'll pose this to the other two guests. What are the characteristics? Like, what I'm thinking about that patient experience. So the care they are receiving as pediatric arthritis patients versus the care that they will receive as adult arthritis patients. What are sort of some of the chief differences between those two frameworks?
I think maybe I can add to this because I've experienced the
Absolutely.
pediatric and adult side of it. I think the difference in length of appointments have definitely changed, and I don't know if that should be a thing, but it is, and I've seen that kind of happen. But that kind of also prepares me to be more prepared when coming into these new adult appointments, seeing the adult rheumatologist. Another difference that I've seen is just the topics of conversation. Like when I'm in pediatric care, I really got to know my pediatric rheumatologist, her family, my family. It was more of an environment where we talked about everything else too. But in adult rheumatology, I realized it's more straight to the point. What are your needs? What do you need? So that's just personally for me. I've seen the differences in like topics we talk about. Also, we focus more on like sexual and reproductive health, and other things that I may not talk to my pediatric rheumatologist about. So I think just in terms of the topics and the length of appointments, and also the care team that I see, I think in pediatric rheumatology, I was able to see nurses and other people, and other healthcare professionals, whereas in adult rheumatology, I just see my adult rheumatologist. And that is different for every single patient. So for me, coming from Ontario, it might be different from another patient that's in BC or somewhere else.
So, Dr. Garner, I'll ask you this follow-up, because I guess this is what you're getting at in the workshop too, is how comfortable, how equipped adult rheumatologists are when they are meeting these emerging adults who are transitioning from pediatric care to their clinic. How comfortable are they? How well trained are they, and what sort of guidelines or best practices are there for these adult rheumatologists to satisfactorily deal with these new patients?
Yeah, it's a real challenge. As an adult rheumatologist, the average age of my patients is probably 40 to 60. I'm used to dealing with problems in that age group, and I'm used to focusing on their medical health, specifically related to their arthritis care or I specialize in vasculitis or vasculitis care, which is sort of a very focused problem. I usually ask about alcohol in all my patients, but it's not sort of the focus of the appointment. And the appointments are very brief. Most Canadian adult rheumatologists are probably practicing in a community setting. So instead of going into the hospital where you have allied health support, you might have a pharmacist, you might have physio. Often the funding for physician remuneration is quite different in the pediatric hospitals compared to sort of usual practice in the adult world, so salaried versus fee for service. And that kind of creates a time pressure that doesn't always exist. We have a great position paper that the Canadian Rheumatology Association has published around what are the needs in transition care, and then what are the gaps in Canada. The Europeans do have guidelines around transition care, and then as a Canadian group, we are working on, there's leadership within Canada that are looking at creating our own Canadian transition guidelines. There's a lot of effort to get, as part of our rheumatology, adult rheumatology trainees going through the system. They do some pediatric work and looking at sort of getting an experience there. But it's a real shift in mentality, and it's building a relationship with someone who, really needs to trust you, because we're just not used to, as adults, talking about sex, drugs, alcohol. What do I do with an 18-year-old binge drinking or using cannabis? They don't want their parents knowing, or we need to talk about birth control. And while that, is often, we defer that to the family doctor, it's really important for our care. And we do need to address that. And a lot of us aren't used to doing that in our usual practice.
That's very interesting. Our audience knows that one of our top priorities from a public policy point of view is around health inequities. And our audience has heard us talk quite a bit about the need, particularly with certain patient populations, BIPOC patients, for instance, the need to develop that kind of trust between the doctor and the patient, and to be able to come up with new ways to deliver care that are culturally sensitive. We don't often hear this pediatric transition in that context, but it strikes a similar refrain. So that's interesting. And so you brought up some topics that are tough maybe for the doctor and the young patient to be talking about. And I'm wondering, one thing that we haven't mentioned is, you've talked about, talking about sexuality, or I think there are a few other topics that we found tough, like smoking and drinking. And certainly I think it's this generation, and I have a son who's 25 years old now. It is very difficult to talk to them because they've grown up with technology and social media. They've been through a pandemic. And one of the things, the sad results we've seen of both of those kind of phenomena and forces is the rise in mental health issues too. Is that something that comes up in this topic that we're looking at today?
Absolutely. So in our workshop, we definitely review the concerns around mental health, some of the risk factors, and how mental health and disease activity kind of go hand in hand. And so, we see it in the pediatric population, the rise of mental health in our patients with rheumatic disease. Dr. Garner, I'm sure, sees it in her young adults in her practice. And Natasha could probably talk about the survey that she performed looking at this kind of burden of mental health and the concerns that youth today have around that and how it affects their disease. So I'll let Natasha go.
Great.
Sure. Yeah, so as part of the organization that I created called Take a Pain Check Foundation, and with the Canadian Arthritis Patient Alliance, we launched a survey to understand the needs of young people with rheumatic diseases globally. And so we had approximately 67 participants living with different types of rheumatic diseases that filled it out. And we were able to find 6 main themes that young adults described as their emerging needs. And some of those did include school and health, work and health, mental health, which are the topics that I will cover in the presentation. But then also they mentioned social support, medication and costs, and just healthcare in general. And so based off of that, we will be developing like tailored resources and recommendations for healthcare professionals, as well as other advocacy groups, to ensure that other patients and their families are more supported when it comes to some of these topics and themes. But we did find that, transitioning from pediatric to adult care did cause a lot of mental health burden or stress within these patients, and they just did not feel as ready. But there were patients that did feel ready, but they found that maybe their body image was something that impacted their mental health when it comes to living with rheumatic disease. So there are multiple aspects that we kind of explore, and I'll be presenting some of that data during the workshop.
So I guess the question, if we turn to rheumatologists now, is how is this being received, and are we seeing change? Because we know, when you get to my age, people are cranky and they don't like to change. They like to kind of stay in their ways. It's easier. What sort of recommendations are you making in the presentation, and what steps can we take to ensure this continuity of care, and that adult rheumatologists are comfortable in the setting, having these conversations and treating in a positive, constructive way these patients?
I think one of the key messages around giving advice to the adult rheumatologist is just to ask the questions. And, the pediatric world talks about the biopsychosocial models, so looking at the whole patient. I would argue that's something nobody as an adult physician would say that's not what we do. But I think what we're really doing in the workshop is stressing the importance of just asking. So asking about mental health, asking about birth control, asking about alcohol, and then providing a supportive environment. So to have those difficult conversations, or they can be difficult, getting parents out of the room, because often it's that confidentiality piece and sort of empowering the patient to know that, this is a safe place. They can tell, we're building this relationship, this rapport, that they can tell us stuff, and mom and dad aren't going to hear about this. This is really a safe space for them. And then as we're doing this, looking at, how we can make sure we're supporting them. And if you're, 30 in your 30s, or you've been in the working world for a while, or you've been through school, you kind of know how to advocate for yourself in most situations. Most of my patients know how to ask for time off work or ask for accommodations. So ask me for a letter of support, but they don't ask, they know to ask. Versus in this population, we're suggesting, you could offer to write them a letter for school so they get more time on exams, or that they can use a computer. There's bursaries available. So these are supports in place that are very easy. It takes me 2 minutes to write a note saying, they require the use of a computer for their exam, or, there is a disabilities, students with diversity in terms of their needs, offices at most academic institutions, or you can ask for accommodations at work and just sort of empowering them. So asking the questions and then empowering them or directing them to the right resources.
So our audience, we always talk to them about the importance of patient education, and it's one of the missions of ACE and CAPA and Arthritis Society Canada, amongst others. We're talking about physician education now, and I'm wondering, you're speaking to that audience in Winnipeg. Has there been research done? Have we found out that there's a self-recognition amongst rheumatologists that we have an issue here, that there are some challenges here, that we need to address how we deliver care and ensure continuity of care? Like, we're going to provide links to some of these papers and studies that we've cited today. And I'm just wondering if there's been any research or surveys finding out how Canadian rheumatologists perceive this issue.
So actually, we did perform a survey a couple of years ago to all Canadian adult rheumatologists and trainees, asking them, what are their knowledge and skills and comfort levels in caring for this unique population, and how comfortable are they asking questions about some of these more sensitive topics like reproductive health and drug use, for example. And overall, many felt comfortable asking the questions, but more have no time, or felt that maybe it's up to the family doctor that should be asking, exploring these topics with them. But we have to realize that many of these young adults may not have a family physician, and many actually see their adult rheumatologist probably more often than their family physician. So we have to use those opportunities to, as Dr. Garner said, ask those questions and empower them with the resources and the support that they require. I think the other thing is, in the pediatric world, our job is to empower and educate our patients to be able to ask those tough questions as well, to be more comfortable asking, because, up until that point in time, it was probably mom or dad or their caregiver asking all the questions to their physician and nurses. But at this point, during that transition period, we now need to encourage and empower the youth to start asking those questions on their own behalf and advocating for themselves too.
Yeah, it is a little complex, right? It's not just the relationship between the rheumatologist and the young adult or emerging adult patient, as you mentioned, the GP, the allied health professional, arthritis health professional, a physiotherapist, as an example, members of that team. And again, they weren't really as responsible or the quarterback of that team, and then all of a sudden they're 18 years old, facing some of these challenges. And I think back to what I mentioned before in terms of our focus on health inequities and disparities. Obviously, there are some patients who can make this adjustment more easily than others because of resources and social determinants of health, which is a whole other topic, but a challenge that can be probably much more serious depending where you live and in your income and education. So I think a topic that we're going to follow closely. We're excited about your presentation, and I hope that we have a chance to do a follow-up with you, because I think this is certainly worthy of more than one interview. So thank you very much for joining us today. We really appreciate your time, and a very important subject. As I said, we're going to have some links that you'll provide me some resources, and we have some as well, so people can get further advanced in terms of their understanding of this really, really important topic. So thank you very much.
Thank you.
And thank you to our audience for joining us.